Next, we move to the topics about facial anatomy, facial muscle, and this is also a very important topic for aesthetic practitioner because when we do the injectables like botulinum toxin injections, it is very important to know the landmarks, insertions of the muscles to deliver the desired result and to prevent the complication. So we start with the forehead. So we have frontalis muscles, two parts of frontalis muscles, left and right over the forehead, and it is responsible to elevate our eyebrows and the forehead. And next, we have the corrugator muscles at the medial part of our eyebrow and also the Procerus muscles at the proximal part nasal bridge, and these muscles responsible for the frowning expression, corrugator muscle and also the Procerus muscle. Thirdly is the Orbicularis oculi muscle. This is a very important muscle. Their function is to close our eyelids. It can be divided into two parts. One is the orbital part, is the outer part, and the other one is the palpebral part, is at the medial part. And palpebral part can further divide into two parts. One is preseptal and one is pretarsal. So orbital part, the outer parts of the Orbicularis oculi, they are mainly responsible for the voluntary closures of our eyelid, whereas the palpebral part can be voluntary, can be involuntary. Next, we move to the mid-face muscle. So the muscle that's responsible to elevate our upper lips, there are three groups of muscles. One is the levator labii superioris muscle, levator labii superioris alegnasi muscle, and zygomatic minor. So these three muscles responsible to elevate our upper lips during our smiles and when we talk. Next, the angle of our mouth, elevation of the angle of our mouth moving upwards and outwards. So zygomatic major muscles and also the rhizorius muscles, their function is to elevate the angle of the mouth moving upwards and moving outwards, right? Next, we move to the muscle of the lower parts, lower face. So first, the muscles that depress the labii, depress our lower lips, depressor labii inferioris muscle, and the muscle that depress our angle of our mouth, depressor anguli oris at the side of our angle of the mouth. And lastly, the mentalis muscle is at the tips of our chin. So there are two bellies of mentalis muscles. The action is to elevate our lower lips. When this muscle contracts, sometimes you can see cobblestone appearance over our chin. And lastly is the platysma muscle. So platysma muscles responsible for the elevations of our neck and depress our lower face. This is the platysma muscle. And next is the muscle of mastication, which consists of four groups of muscle. One is temporalis muscle at the temporal fossa, and masseter muscle, and the internal muscle is the internal pterygoids and lateral pterygoid muscles. So for the practical purpose for botulinum toxin injections, we can be divided into the upper face injections. Upper face injection mainly focus on these three areas. One is the forehead wrinkles, the second one is the frown line, to reduce the frown line, and the thirdly is to reduce the crow's feet. Forehead wrinkles, the injection of the toxins is to reduce the activity of the frontalis and subsequently reduce the forehead wrinkles. How about the frown lines? Injection of the toxin at the corrugator muscles and the Procerus muscles reduce the frown line. And thirdly, the crow's feet. Crow's feet is mainly contributed by the contractions of the lateral parts of the Orbicularis oculi muscles. So the injection over the lateral parts, a few points, 3, 4, it inhibits the muscle activity and reduce the crow's feet. The next is the masseter muscles. Some people, they have a very prominent masseter muscles that makes their face very square. They want to look slimmer. The injections of the toxins over the masseter muscles reduce the muscle bulk and the face will look more V-line and thinner. But it's very important to know the landmark of the masseter muscles, the landmark that you can inject. So the upper border will be the angle of the mouth to the earlobe. That is the upper border. And you need to palpate the anterior borders and posterior borders of the muscles by asking the patients to contract. When they bite, you can feel the muscle and you can feel the anterior borders and the posterior borders of the muscles. And the lower border is the jawline. So that is the areas that you can inject to reduce the muscle bulk of the masseter.